Zero COVID Canada is a group of Canadians and that believe that it is possible to eliminate, so that's the key word, eliminate COVID-19 from every province and territory. So we're coming from various walks of life. So there are doctors, teachers, business persons, engineers, retired person, students from each province and territories. And just want to highlight that this is a citizen-based initiative. We also collaborate with other groups, whether it's End Coronavirus, COVID is Airborne, Mask for Canada, COVID Stop, the Zero COVID Alliance as well. So we have collaborations with many. Today we want to talk about a solution to this uncontrolled pandemic. So the idea is to take the control back on our side, rather than having the virus and all the variants taking control of our context, of our situation. We sent an open letter to in fact, the Prime Minister of Canada himself, Justin Trudeau, plus the public health officers. We did that to all provinces as well in the last week. We already have almost 5,000 signatories on the letter. I think just before you came in, we were at 4,800 something. So we were right there. There are many reasons for going to go towards a zero COVID zero elimination strategy approach, and that's what I will let my colleagues talk about in the coming minutes. So maybe Gosia, you would like to talk about all the data we see right now in Canada in the virus. I will let you go ahead.
Hello, good afternoon. My name is Gosia Gasperowicz. I'm a developmental biologist, and I observe how COVID spreads, what is the dynamics of it. And basically the COVID spread is similar phenomena to such phenomena as wildfire or cancer, melanoma cancer, in that way that if you have just a little bit of it, you are in danger. And anytime it can explode into a big trouble. So that's what we have with COVID. And interestingly, it's that if we have restrictions in place, they can drive the cases really quickly down, and it's exponential decline. And if we get to zero with it, then basically we are in a safe place. If there is no community transmission, it cannot grow back because nothing can grow from zero. But if we leave them at just 10 or 20 or maybe 100 daily new cases, it's like a fire starter. So you reopen, you blow some fresh air to it, and the spread continues. It basically restarts and start growing, maybe first slow, but then it can burst into second wave and third wave, like we've seen now. And now with the new variants, we are even in a bigger trouble because they are more contagious. So they grow much faster, they spread much faster. And what it means in practice is that some measures that work, that were able to bend the curve of the original variant, so they bent it once during first wave, the second time during second wave, some of them might not be enough to bend the curve of the new variant. So we need stronger measures and much faster to bend the curve. And we need to do it till the end, like till zero, because also what the new variant make that if we again go to 100 daily new cases and reopen, we might have maybe 1 week of respite, and then it will start growing again and growing fast, because the exponential growth rate of a new variant is faster, is much steeper. So basically we don't have any other option than to eliminate the virus and to quench it completely. Thank you. So now I'll pass to Conor, who will
thanks for attending. So my name is Conor Ruzycki. I'm a PhD candidate and Killam Scholar at the University of Alberta. I wanted to talk a little bit about how our understanding of the transmission of SARS-CoV-2 has evolved in the past year. We now have substantial and quite convincing evidence that airborne transmission of this virus frequently occurs. And airborne transmission in this context simply means that we're inhaling infectious particles that are emitted by carriers of the disease. And these particles can build up in poorly ventilated spaces indoors. We also know that pre-symptomatic and asymptomatic transmission is pretty significant, accounting for potentially up to 50% of all transmissions. And this means that people who are infected with COVID-19 but don't know that they are sick, they're able to, and they frequently do, transmit this disease to others. And this is one of the reasons why this disease has been so difficult to get control of. So our messaging to the public and our policies that we've adopted in our workplaces do not actually reflect this current understanding of the transmission of SARS-CoV-2. I think we need to revisit public health messaging and reevaluate the measures that we're using to mitigate the spread of this virus so that we can really make use of all the tools that we have access to that can help reduce airborne transmission. This includes things like better masks, more widespread use of respirators for essential frontline and healthcare workers, better ventilation, air filtration, reducing the time spent in high-risk environments, and a focus on moving things outdoors as much as possible. Airborne transmission really means that this virus thrives on indoor gatherings and indoor workplaces when we don't put the proper mitigating strategies in place. And airborne transmission isn't something we need to be afraid of, but it's something we need to be aware of so that we can address it properly. And without incorporating these measures, we don't really have much of a chance of keeping transmission contained, particularly with these new variants of concern that are showing increased transmissibility. So moving forward, we really need governments across Canada to directly and clearly acknowledge airborne transmission so that we can begin to implement more effective mitigation measures. And to link this into COVID zero, or zero COVID rather, zero COVID really provides the best way of avoiding airborne transmission by simply eliminating community transmission before it can happen. And this is obviously a tremendous benefit to the health and well-being of our essential workers and to our population in general. So thank you. With that, I'll pass this off to Tehseen.
Thanks, Connor. I'm Tehseen Ladha. I'm a pediatrician at the University of Alberta. I'm an assistant professor within the Faculty of Medicine. I just want to touch a little bit on using hospital capacity as an indicator to determine policy during the pandemic. And I think it's quite clear that each wave of the pandemic is evidence that mitigation strategies, especially mitigation strategies based on healthcare capacity, do not work. Not only is it a failure to use healthcare capacity as a metric, but it's also unethical because each person, each infection represents a person who could be hospitalized, who could be in the ICU, who could die. And so really what we're saying as a society, when we allow this to occur, is that mitigation, it means that some people can die so that others can dine out for a couple of months before the next lockdown. And so I think there's a really important need to shift our narrative to saying that infection is not okay. This is a preventable infection. And it's really important also to acknowledge that each infection represents a person that has up to a 30% chance of long-term symptoms and disability, so long COVID. New studies are suggesting that children are also getting symptoms of long COVID, even with asymptomatic COVID infection. So here we are potentially committing large parts of our population, including children, to long-term pain and disability. And I know at the start of this year, we all had hope and optimism that we would be returning to normalcy quite soon. And that was due to the vaccine. And while there is still hope, and of course, the vaccine is an essential part of getting to the light at the end of the tunnel, it's not a ticket out of this. The vaccine will not single-handedly bring the pandemic to an end. And why is this? It's because we need herd immunity, of course, and herd immunity could take 70% or more of the population immunized. Children won't be immunized for quite some time, and they make up about 15% of the national population. So that's certainly a consideration. And then as we let the virus circulate, it mutates, and we've seen this, and we're having importations of variants that eventually are going to be able to escape the vaccine's immunity. And so this is why it's critical that we really get down to zero infections. That really is the only feasible way back to normalcy, and really the only exit strategy that will work is zero COVID. Thanks, and I'm going to pass it over to Dr. Joevipond. Sorry, Dr. Darren Markland is next.
My name is Darren Markland, and I am an intensive care physician at the Royal Alexandra Hospital. I have nothing much to add after Dr. Ladha has spoken, because she's taken most of my thunder, but heed her words. I am somebody who's well known on social media to promote prevention, and that's an odd position for an intensive care physician to do, unless you realize the reality of what happens when you come to ICU. Unfortunately, most people have some very Hollywood ideas about intensive care medicine. What we really do is catch people before they hit the brick wall, both socially, physically, and mentally. These patients not only use a lot of resources and capacity, but also are left with lifelong scars, disabilities that we're all going to pay for, either through education or social support systems. Not to mention the fact that every wave has a social toll, and the staff that I work with are unique people, not just the nurses and the respiratory therapists or occupational therapists and specialist physicians. We have a lot of people here who likely will not be here in the next year, because these people are being used as cannon fodder and as the tip of the spear. The reality of the fact is, with the way that this world is going, this will not be our last pandemic. This will not be the last infection that we have. And it's time to reevaluate our approaches to these new diseases, which will sporadically appear. And it's time to start now. And the reality is, to do these things when we've done mitigation strategies that have failed, to repeat these things is truly the definition of insanity. So let's start learning from our mistakes, move forward, and make both medicine and our world a better place by doing this.
Am I next? I think I am. I think I'm running this out of what we need to do in order to get there. And the reality is we know what to do, because it's been done. We're not trying to reinvent the wheel. We're not trying to be radical. We're just asking that jurisdictions like the COVID-6, the provinces that have tried to live with the virus, start to adopt a zero COVID policy, like has already been enacted in Atlantic Canada, in Australia, New Zealand, and in East Asia. There's 6 main things that get us there. It's having an explicit goal of COVID elimination. If we all know where we're aiming for, then when we get there, there's a victory. This roller coaster of going up and down, all it does is make the public jaded, that we are not succeeding. Every time we beat a wave, but then it's not totally beats, it fosters the inability for people to continue abiding by these restrictions. Number 2, we need international and interprovincial travel restrictions. This is to keep new variants from coming in. We already have COVID here. We already have 3 different variants in my home province of Alberta. So now that they're here, we're stuck with them. But let's keep the next ones from coming in. The California variant, the India variant, the Japan variant. They're all have different characteristics, and we don't want them within our jurisdiction. We need to financially support this lockdown. We know that this impacts people in different ways. This impacts businesses, this impacts workers. And so all of these individuals and organizations need to be helped through the lockdown. There is an end to this, and we just got to get everybody through to that end. We need in-person learning so we can transition. In-person learning should transition to online learning. We still need to support our students, but they need to be doing this from home until we get to COVID-0. We need to fund an aggressive test, trace, and isolate capacity. We need to be the best at this ever, so that we can really aggressively tamp it down. And we need to provide clear guidance to follow airborne precautions to protect against COVID. And I think Conor has really well outlined why that is. If we do these 6 measures, we can achieve COVID-0, and then we can be normal. We can go back to dining in person. We can go back to socializing. All the things that we want are within our grasp, but we have to stay the course and get there. So that's why we want a zero COVID strategy. Back to you, Gosha.
Thank you very much, Joe. So now we have time for questions and answers. So do you have any questions that we can elaborate on?
So if there is none, I think we can make sure that we can share what you've seen today. So that was recorded as you've seen. We'll be able to share that with those who are participating. And if you have questions, definitely anytime afterwards, don't hesitate to reach out for any of us. We'll make sure that you have the coordinates required if you need to contact us afterwards, if you have questions, if you need more on this or that, of the items we've discussed. I think you understand now what is zero COVID, why it is important, and why it is important to do it now. And also, that has been already used and well used in Canada. Essentially, keep in mind that the Atlantic bubble is essentially a great example, worldwide example of the use of this elimination strategy. So it's just for, as Joe mentioned, for the 6 COVID provinces to do it the same way as the 4 Atlantic provinces and the Northern Territories as well, which gave another good example of this. So thank you very much for having been there today. We'll give you some more insight, so make sure you let your coordinates so you will be able to share the information and contacts afterwards. Thanks very much.